Good afternoon. Vidyapeeth Kamath from Mangalore, in the Department of Practice of Medicine. So before going into this particular CBDC workshop in practice of medicine, what I want to tell is that we have been teaching for 20 years or more than 20 years, or some of us less than 20 years. We have been teaching the practice of medicine. It is not that we have been doing something different from CBDC. We have been doing, but we are not formulating it in proper structure. Now, what CBDC is that you need to have a proper structure and a proper formatting the presentation. Okay? And it is not new, but it is not different. What we have been doing all these years. Okay? With that, we start. Coming to the outline, what we are going to see in the whole presentation is that overview of the CBDC for the subject of practice of medicine. I think all of us have got the soft copy of the second year CBDC bill. In that, I see appropriate teaching learning methods or media for the subject of practice of medicine. Then integration of interdepartmental learning activities, formative and summative assessment, assessment blueprint for theory, practical and oral examination, dimensions of assessment and scoring for practical and clinical examination, and identification of competencies for oral examination, and designing the timetable for the subject as per the time allotted, and preparation of a comprehensive and inclusive academic calendar of points. These last two subjects I am not going to do. I am not going to name because it is the domain of the individual colleges and individual departments. Because depending on the number of hours what we are allotted for our department, all the numbers are available with the institution for our department. So differs from that we have to design the timetable and the division of classes. So the first, the structure of syllabus, I am going to just give the what the index will be. The preamble, then we come to the course outcome, pages 2 and 3, the learning objectives, pages 3 and 4, the course containment term and terms distribution is page number 5, then teaching hours in page 5 to 16, that you have to cross division of teaching hours for theory, teaching hours for non-lecture hours, and distribution of teaching hours with breakdown of each topic. In the second year, okay, though we are having the second year, third year, fourth year CBDC. In medicine, we are taking only second year because the third year CBDC is in the process of completion. The fourth year, it takes some time. So, second year, with the syllabus design, that the majority of the topics are in relation to pathology and microbiology. So, as they have finished this anatomy and physiology, we are including that also aspects of those applied aspects of the anatomy and physiology in second year. The pathology and microbiology also in medicine. So the distribution of teaching hours will be breakdown of each chapter. Then content value, the largest volume is the of the curriculum, that is 165. Teaching learning methods, page number 166. Details of 167, 68. Page number 167 and 68. List of recommended books. 168, 169. Okay, list of recommended books. There are lots. Okay. When we say it, we say that we will give everything. But what the experts wanted is that you limit yourself only for the second year. So you are not added the major portions of the mathematical organ, philosophy and repertoire. Even the medicine books also we have limited for the second year. Then the list of contributors. The syllabus flow. The preamble, it looks into the overview of the practice of medicine in homeopathic therapeutics. So this preamble is, I think, it is almost same for all the subjects. There is no difference. The first outcomes, development of skills, knowledge and attitudes required to become a competent clinician. Emphasis on integrating clinical knowledge and homeopathic principles is highlighted there. The learning objectives, that is more specific to the practice of medicine. Specific skills and knowledge to be acquired by students by the end of the course, including evaluation of signs and symptoms, understanding the infectious disease, immunity, susceptibility, and medical genetics. That is all the subjects what we are going to deal with. Second, the course content and term-wise distribution. It includes a breakdown of topics covered in each term, divided into theory and non-lecture sessions. Okay, we are given it as 40 hours. First term and second term. The lecture hours, non-lecture is 12 in the first term and 12 in the second term. I don't think we are going to get that many number of hours also. Because majority of the institutions where we are getting the actual working hours are 9 months only. Once they pass out the first BHMS, get the result, and before they go for the second BHMS examination, we may get maximum or practically 9 months. Okay, little more also we may get. So it depends on us. The teaching hours, total teaching hours divided into lectures and non-lecture hours, gross division of teaching hours for different topics. Content mapping. Detailed breakdown of teaching hours for each topic, including the specific areas of focus within each topic. Each topic has been divided. The specific learning objectives, what has to be highlighted in that, have been given. So, the thing is that many times what happens is that in our lectures or when we are giving lectures, many times we may move this side and that side and again we come back. This one doesn't allow us to move this side and that side. We have given specific onto the specific learning objectives and limit ourselves to that. So most of the times I think that much is sufficient. Teaching learning methods used for teaching the course content including lectures, clinical sessions and demonstrative sessions. Details of assessment, information on the assessment methods and criteria of the course, and list of experiments. So this one thing is important because when we look into the initial budgeted notification, we had almost 92 hours non-lecture hours. Okay, if you have gone through. Okay, but when the CBDC curriculum is, they have limited 24 hours. Okay, so why these 24 hours are only, or why 82 or 99 are cut down to 24? Because what the experts wanted is that in the second page in this for the practice of medicine, we are only orienting them the clinical policy bedside. How to go about the case taking all those things. So majority of the hours are being distributed or redistributed to, that is from medicine also, OPG also, and also from surgery. So second year the clinical hours are reduced. So these hours are redistributed to organ, then mathematical and repertoire. So they have been given more number of hours. The reason is one, enhanced focus on course subjects. By redistributing the non-lecture hours to mathematical, philosophy and repertoire, students will benefit from a deeper and more focused understanding of these fundamental subjects. This approach aligns with the goal of producing proficient practitioners well versed in the principles and practice of homeopathy. Principles and so it is only with the understanding that if they are exposed to these subjects in the bedside or detailed exposure is there, then they have become well versed in the principles and practice of homeopathy. Second, optimal use of educational resources. Reducing knowledge hours allows the more efficient use of educational resources, including the faculty time and institutional facilities. This optimization ensures that the students receive quality instruction while maintaining a manageable workload. So, the amount of workload for very much reduced. Improved student engagement and performance. So not asking how it happens. A well-structured timetable with a balanced distribution of hours can enhance student engagement and academic performance. Concentrating efforts on essential subjects will help in building a strong foundation and better preparing students for their professional careers. Okay. So the whole idea is to concentrate more on the homeopathic course subjects so that the student understands the application of those subjects in practice of medicine, surgery and OBGYN. Then alignment with contemporary educational practices. The proposed changes are aligned with contemporary educational practices that emphasize active learning and practical application. By focusing on core subjects, we can incorporate innovative teaching methodologies that foster critical thinking and clinical skills. Coming to the major, that is teaching learning methods. We have an overview of methods, purposes and application. So first is the lecture methods. I think one is not taken in detail. But he said that after session you will have much more detailed presentation. The purpose of lectures is to convey foundational knowledge and theoretical concepts. One. Then second, efficiently cover a large amount of material to a broad audience. The method, oral presentations, often supported by visual aids such as slides and videos that I am doing. I am doing only lectures. Can include interactive elements like question and answer sessions. Application, best suited for introducing new topics or providing an overview. Then commonly used in large classrooms, typically at the beginning of the course module. So for me, the lecture method is appropriate. Then integrated teaching. The second. The purpose, foster a comprehensive understanding by linking the related subjects. Encourage the integration of knowledge from different disciplines. The method, collaborative sessions involving the faculty from various departments. Case discussions or problem solving activities that draw from multiple areas of expertise. Okay. So when we are looking into the competency tables, we are having an integration. The last column is there. Integration where we are seeing that the anatomy, the physiology, pathology, community medicine, all these things are. So this integrated teaching is in relation to that particular last column of integration where we have to incorporate their expertise in teaching. Application useful for showing the interconnectedness of different subjects like anatomy, physiology, and technology. Often employed in interdisciplinary modules or clinical based discussions. Anything?
Integrated teaching.
Yes, sir.
What is the expectation? If 1 hour lecture is there,
something, then we are taking from there and we are explaining. It is not that they are going to come. It is not that. See, ideally speaking, it should be like that. Because what is happening in the competency-based curriculum of modern medicine, they are in the same. They are taking directly from the first year everything. For a cardiovascular system, the anatomy person teach anatomy, the physiology person describe the physiology of this one, the pathology person describe the pathology, the medicine person come and explain the medical aspects or medicinal aspects of that particular system. So that is what is happening from the first year for them. I don't think that is going to happen because the first year CBDC didn't say that. First year CBDC didn't say that. First year competency based curriculum of modern medicine has that. We don't have that. How is this different? Okay. So that's what I was saying. That is our responsibility to integrate and explain to them. Because other departments are there, their department will work, their number of classes, their practicals and all those. I don't think they will be able to come into our class. And I don't think that we will accept them coming into our class. Yeah, madam?
So we take question and answer.
Integration is what I feel. What I say is that we have to do the integration. Now, take materials from this and explain.
So you mean to say that we have two key slides and we explain the pathology?
Madam, otherwise is
We have to nomenclature.
Next, clinical and practical demonstrations. So, purpose is to bridge the gap between the theory and practice, develop hands-on skills and clinical competence. The method: practical sessions such as lab work, dissections, and clinical rotations. Demonstrations by instructors on how to perform specific tasks or procedures. The application used in clinical settings, labs, and practical workshops. Essential for training in diagnostic techniques, procedural skills, and patient interaction. Then, case-based discussion. This is to enhance the clinical reasoning and decision-making skills. Encourage the application of theoretical knowledge to practical scenarios. Method: group discussion centered on specific cases. So, for example, we have clinical meetings for students. So, for example, I am there in my college. What we do is that every week we are having a clinical meeting on a specified day and specified time. 2 hours we have a clinical meeting. So, the senior student or the intern will select a case, pick it appropriate for that particular batch or particular year, and the case material is given, all the data is given in that particular batch of students in advance, so that 2 or 3 days before the set time they are supposed to submit the workings. The person who is in charge, he has to go through the material, give his evaluation and observations, and give it back, so that on that particular day the students will participate or actively participate in the discussion. Okay, so the group discussion centered on specific cases, facilitated by an instructor who guides the discussion, prompting students to consider various diagnostic and treatment options. So the senior student or the intern will be standing here. For example, if I am the moderator or the supervisor, I will be sitting along with the students and I will be guiding the discussion along with the guide. Application frequently used in clinical education to teach diagnostic processes and patient management. Helps the students to develop a systematic approach to patient care. So the objectives of this can be different. You can go in for the diagnosis, you can go in for the selection of remedies, you can go in for the management, you can go in for the follow-up analysis, anything, depending on the case and depending on the group. Problem-based learning. So purpose is to promote self-directed learning and critical thinking. Prepare students for real-world problem solving. The method work together to solve complex open-ended questions. Facilitator provides guidance but allows students to explore and research solutions independently. I think morning sir had said about this. Application used to encourage deeper understanding and the ability to apply knowledge in unfamiliar contexts. Common in integrated and student-centered curriculum. Practical sessions. Purpose is to develop and refine clinical and technical skills. Method: supervised practice in a clinical setting, simulation lab, or skill stations. So 3 areas you can utilize. Application vital for mastering the clinical procedures, diagnostic techniques, and patient management. Simulation in mannequins. I think the LCHS committee are saying that every institution should have a skill lab. Every institution should have a skill lab, and the whole process of having a skill lab or installing a skill lab is very, very costly. Okay, because each mannequin costs around some lakhs, not just more than this. So the thing is that many institutions find it very difficult, and for us, we are having a very good so they are having a well-established skill lab, and we are utilizing that. Okay, I am telling you what we are doing. Otherwise, it is not possible. Okay, so this is to provide safe environment for practicing clinical skills, because the mannequin will not show. Enhance competency in procedures and emergency response. The method hands-on practice with high fidelity mannequins that simulate various medical conditions. Okay, high fidelity mannequins, various medical conditions may include scenarios like CPR, ventilation, managing cardiac arrest. Examples. Application: critical for training in procedural skills and patient safety without the risk of harming the actual patient. So, unless until the individual becomes an expert in that particular procedure in the mannequins, he will not be doing that particular procedure in the bedside. Often used in advanced clinical training and emergency preparedness courses. Hospital. Okay, this is one that has been there, but only thing is that now this CBDC we are going to, or we are talking more about. Okay, objective structured clinical examination. So purpose is to assess clinical competence in a controlled and standardized environment. Ensure that the students can perform peak clinical tasks reliably. Method: series of stations where students are observed and evaluated while performing specific tasks. For example, when we are having the bedside examinations, every student will be given different cases, and student will always tell that I got a tough case. Okay, he got easy case, I got CNS, he got RS, he got OA, all that. So to avoid all these things, we are having this particular modality. So stations are specific. Every student has to go through that, and he will be evaluated based on his performance. Okay, so no partiality, no discrimination. Each station is timed and standardized to ensure fairness. Specific time is there, 10 minutes. Every student will be given 10 minutes to do that. Application widely used in practical examinations to assess a range of skills from communication to clinical procedures. Okay, maybe. Okay, I'll tell you. Provides objective data on student performance. Okay, objective data. No subjective. Mini CX, mini clinical evaluation exercise. Purpose is to provide formative feedback on clinical skills in real time. Encourage continuous learning and improvement. Method: short, focused assessments during actual patient encounters. This actual patient encounters are there. Observer, for example, me will be the observer, student will be doing that, and immediately soon after the process, I will give the feedback. What are the happening, where he has to improve. Evaluator observes the student during his specific interactions, such as taking history or conducting an examination, and provides immediate feedback. Application used throughout clinical rotations. Throughout, not that we are specifically assigning some time for mini CX. Throughout the whole process of rotations or the rounds when we are going with them, we will be doing that to assess the progress and identify areas improvement, promotes ongoing development of clinical skills. Next is seminar, integrated medical education. So purpose to facilitate deep exploration of integrated topics, encourage active participation and critical analysis. Okay. So structured presentation by students or faculty on topics that integrate various aspects of medical education may include discussions, debates and question and answer sessions. So it covers a wide range of topics. It can go in with the inter-department, it can be a specialty, or it can be a specialist coming and delivering lectures. Application useful for exploring complex or controversial topics in depth, encourages the integration of knowledge across different disciplines. Tutorials, that is small group projects. So here the purpose is to facilitate deep exploration of integrated topics, encourage active participation and critical analysis. The method structured presentation by students or faculty on topics that integrate various aspects of medicine is very similar, but it is a small group. Useful in exploring the complex or controversial topics in depth, encourages integration of knowledge across the different disciplines. Chart and model. I think the NCH is asking us to have charts and models prepared by students. We are supposed to store it, or keep it, or evaluation. So purpose, simplify and visualize the complex information. They are giving the students some subject and they have prepared. Enhance understanding of structures and the processes. Method, use of charts, diagrams, models and other visual aids to represent anatomical structures, disease processes or physiological functions. Often accompanied by explanations or guided learning sessions. Application, commonly used in subjects like anatomy, physiology and pathology, where visual understanding is crucial. The floor is also very helps students to grasp spatial relationships and processes that are difficult to convey through text alone.
Now the query which we are facing is every student supposed to prepare the charts like
You assign a particular chart making or model making for 5 or 6 students, group of students. So that they come together, they pool their resources, all means their ideas, and then they present it to the staff. So the staff approves, then they can go ahead with the model making or the chart making. See, for example.
So now the list of charts, the list of charts and list of models is specified.
That is for us to keep display. But students have to prepare charts and models for different areas.
So you mean to say the
Not
100
that.
students are there in one batch?
The students are there, you make a group of 7 or
5
8
or
students,
8, okay.
depending on their, what is it?
Cohesiveness. Okay.
Then bring them together, give them a specific topic, give them, ask them to go with it, brainstorming, tell me some ideas, what you want to do with it, and how you want to present it. And once you approve that, because to your satisfaction, then they can go ahead with the preparation. See, what I want in a particular model and what the student does in a particular model may be totally different many times. My understanding of that particular topic and the student's understanding or appreciation of that particular topic is different. So, unless they come up with what I want, then I can ask them to go back, work it out, go to these references, give them specific areas to refer, and come back with an idea.
These are not necessarily the charts which are given in the list of them.
Charts in the list of NCH, whatever given references are given, but where you have to get these charts done.
So that can be done manually. That just
That you can
needs
ask
to be done.
the management to get it done.
Yes, exactly.
Give the order, print it, display.
This is students quality, we have improved for that purpose.
For that. So, grasp this participation is a process that are difficult to convey.
Actually, that we are doing in simulation also.
Simulation is different. The understanding and simulation is complete. Understanding when they are preparing the chart and models is different. There their involvement is
It's like a project which they do with
because they are involved more in this chart making process. Assignment. So this is to encourage independent research, critical thinking and application of knowledge. Assesses the students' ability to synthesize information and present their findings. The method written or practical assignments on specified topics which may involve research, case studies or project work. Often followed by presentations and submission on a report. The application used to gauge the students' understanding of course material and their ability to apply concepts in novel contexts. Provides an opportunity for students to explore topics of interest and entertainment. So here, when we are giving assignments, I don't think we will be giving assignments just related to medicine, but also the parallel aspects of the medicine and the latest what is happening in the field of medicine. So it is not that we will ask the student just go and work it out and come. No, we will be giving the specific web links or specific areas for their workout, and they have to go through. All the materials in that, then compile it, bring it together and present it. Okay? Either as a report or as a presentation. Good. Self-directed learning. Purpose is to promote independent learning and lifelong learning skills. Method is to provide reading materials, online resources and assignments. Application important for research, self-assessment and continuing education. That is in relation to this only. That is a part of self-directed learning. Then, when the learning is over, there is assessment and feedback. The purpose is to evaluate learning processes, learning progress, and provide constructive feedback. Method use quizzes, written tests, practical examinations, and projects. Application critical for measuring, understanding, skill development, academic progress. That is the whole idea of assessment. Integration with syllabus. Okay. First is inpatient studies. The lectures, we are using lectures there. Core concepts and theoretical knowledge. Case studies as real life examples and clinical application. Then practical sessions for diagnostic procedures and treatment methods. Okay. So for infectious disease, we will be using most of them the lectures, case studies and practical sessions. Then immunity and susceptibility. There we are in interactive discussions because the topic will be taken simultaneously in the biology and microbiology. So immunological factors and homeopathic perspectives. The workshops, detailed exploration of susceptibility and immune responses. Is there they have to take their understanding from the organelle into the presentation. Self-directed learning, online research on specific immunological disorders. They have to evaluate the research studies and literature to inform decision making in the treatment and management. Means what is the latest that is happening? Okay, in this particular area or in that particular condition, what is the latest? What has happened and how I or we can utilize that particular knowledge into the treatment. Medical genetics. Again, lectures, basic principles and genetic mechanisms will be described. Problem-based learning, genetic case scenarios and problem solving. Group projects, again, research assignments on genetic conditions. Similarly, evaluate the research studies and literature to understand the latest developments in the field. Okay. So that we make the students to study and understand what is happening in the field, what is the latest in the field. Not that every student will do that. I will copy from somebody else also. Assessment methods. Formative assessment. The quizzes, group discussions and practical skills evaluations to monitor the ongoing ongoing process. Summative assessment, written exams, clinical assessments, project presentations to evaluate overall learning outcomes. So these are the two we are having in the third month, 6th month, 8th month, and 10th month. That is the last. For second year BHMS, medicine will be taking some at the 10th month because we will be going for the university examinations. Before that, they will be having an internal examination. So during that time, we will be having our medicine. What you say, the practical examination, no theory examinations are there in the second year. Integration of interdepartmental learning activities. Okay. So, purpose and objectives. Sir. Promote interdepartmental collaboration and understanding. Enhance comprehensive learning by integrating knowledge from different subjects. Foster a holistic approach to patient care and management. So this is the whole idea of integration of different departments. So departments involved everything starting from anatomy, physiology, pathology. When I come into third year pharmacology, medicine anyway we are there. Homeopathic methodology, homeopathic medicine left out. Philosophy is left out. So key interdepartmental activities, what we can have or how we can do it. Okay? Or how much we will be able to do it. That we have evaluation at the end. As sir said in the morning. At the end of the second year, we will do an evaluation how we have done it. So case-based learning sessions 1, as I said before. Okay, we will have a clinical meeting. We will have a particular scenario is given, and we will call all the other department people to come and participate, give their observations, suggestions, and help the students. So description, collaborative case-based sessions where different departments come together to guide or help to discuss and manage clinical cases. Departments involved, anybody and everybody. Learning objectives. Apply knowledge from different disciplines to solve different problems. And develop diagnostic and therapeutic strategies. Means you have to design the objectives in such a way that the student himself is forced to go back to that particular subject and read the relevant areas and come for discussion. Am I clear? So that is the idea. So develop diagnostic and therapeutic strategies. Example activity: discuss a case of chronic pain involving inputs from anatomy, there is a pain pathways, physiology, the pain mechanisms, and pathology, the disease process, and the homeopathic therapeutics, there is a treatment. Simple example. We can have complex presentations also. And then integrated clinical rounds. Basic question. See, simple thing. See, for example, I am giving engagement to all of you. I am giving engagement to all of you in advance. I will be asking your workings based on the objectives what I have designed. And I will be giving you my evaluations on all those things. Okay? And the session will be there. 1 hour or 2 hour session will be there. That all are supposed to come, all have come. And we have a thorough discussion. And at the end, have we achieved the objective? What is the objective? What is given in the material in the first time? Have they achieved? And what is the So, what I want is that at the end, that I want an evaluation report from you, all of you. And what I do is that the case material, what I have given, the workings, what you have given in the first, and what I written, and you have to return back along with the evaluation reports. And that I will be filing to you. I understand or what I understand varies. Depending on my preparation beforehand, depending on the discussion that is gone through and what I have understood at the end. So that I will put it in a paper and that will be kept as a fact.
Case discussion is kept in this field. 10 students will be selected.
Not 10 students, for that's the whole class, for 100 students, for whole class.
And all these subject experts will be there.
All teachers have to come because those scholars nobody is having any class. No, true. See, this is my culture. What we do is that on Wednesday, first 2 hours in the afternoon, we have clinical sessions for all the batches. All the batches. So every department is free.
Everybody will come there.
Everybody can come.
Whole class.
Everybody can come. See, one staff from each department can come to all the classes. It is not that only one staff will be there in any department. It is 3 or 4 will be there. So they can attend depending on what are the objectives in a particular given case, in a particular specific class. They can come and attend there and do the job. Ideal situation.
So the appendix sheet sort of a thing where he writes that okay, I have understood about
No.
the
They
base.
don't be printed sheet. They have to think and write. They have to think and write the evaluation report. Don't
About
printed sheets.
okay, about that particular case and the overall understanding.
Overall discussion, after that, at the end, what I have understood, I am going to write everything in detail.
And that we are supposed to evaluate.
No, but if you want to evaluate, you can evaluate for the individual person, what has gone wrong with him, where has gone wrong, what is the problem, individually can discuss. Individually.
Okay.
Okay, that is what we call formative. Depends. It is not that always a problem. We will be having a problem. I can proceed. Okay, integrated clinical notes. This is a major problem. Description joint clinical notes is only done from various departments. I don't think they know. Departments involved. Learning objectives. Enhance clinical skills through real-time patient interaction. Understand the role of different specialties in patient care. Okay, this is the most important aspect of integrated learning. Okay, if we go with all these people, then we will be able to impart this particular understanding. Example activity clinical notes focusing on infectious disease. This discussions on pathology, clinical features, community health implications, and preventive management. Okay, so here, when I have given the example, I have not included any of these departments. Okay, so what I said is that the clinical notes focusing on that if I am taking the rounds, I have to discuss all these aspects with a group of my students who are with me on that particular day. Okay? Because other people have their own places and going for their rounds. So not possible that all will come with me. Then workshops and seminars. Description. The thematic workshops and seminars conducted by multiple departments on relevant topics. Departments involved. Here, 2 or 3 departments can come together and organize a workshop. Okay? So organize a workshop, 2 or 3 departments come together and do it. The learning objectives gain in-depth knowledge on specific topics. Learn about integration of pharmaceutical and homeopathic treatments. Example activity, workshop on pain management, covering the pharmacology of analysis, the physiology of mechanism, and homeopathic approaches. Okay, this particular aspect of pharmacology comes in third year. Okay, I am giving only examples. Then research projects. Now, madam, proceed. Now, the NCHS is that they have brought in STSH programs for the students. So, when that has come, I think this also becomes important for us. Okay. Description: interdepartmental research projects where the students conduct studies involving different clinical conditions. Departments involved: all relevant departments. Learning objectives: develop research skills and interdisciplinary collaborations. Then explore innovative solutions to medical problems. Example activity: research project on the efficacy of homeopathic treatment in managing chronic diseases involving clinical data from the medicine, therapeutic insights from homeopathy, and statistical analysis of community. Because these are the things that is involved in any research work. Because you have to collect the data, you have to analyze the data, then you have to compile the data. Correct? For any research. So from the OPD or the IPD, the student will be collecting all the data. Then the therapeutics, what the medicines are given, how the medicines are worked, what is the outcome of the treatment, all that data will collect. Then statistical analysis of the whole thing and present it in its specific form. Community health initiatives. Okay, this will be done, a major part will be done by the PSC. Okay, social preventive social medicine they will do. The description: collaborative community health programs addressing working issues. Departments involved: community medicine, medicine and homeopathic veterinary. Learning objectives: apply clinical practice knowledge to community health problems, promote public health and preventive medicine. Example: health camps focusing on preventive care, where the community medicine provides public health data, medicine handles the clinical care, and the homeopathic software offers the alternate treatment. Okay, so the whole process is that when a student specifically from the community medicine goes for the village programs or community health visits or goes for the primary health centers, so there they will be doing these activities. So these activities have to design in such a way that these activities are done and departments are involved. Assessment and feedback. Okay, schedule and coordination. So faculty representatives from each department should be there. Schedule pre-planned calendar with joint activities, workshops and seminars. Okay, this year we have joint activities. Like I said, in our college we are having 2 hours specifically dedicated for. So all the batches will be having those 2 hours. All the departments are free. They can take it. Monitoring and evaluation, regular meeting to assess progress and next necessary adjustments. The models that I said that we will have a committee at the highest level, so that they will be observing, they will be evaluating, they will be giving the feedback. So that is the one. Okay, coming to the formative and summative assessment. Okay, so the formative assessment activities are the quizzes, the class discussion and participation, case study analysis, practical skill assessment, group projects and presentations, and reflective journals. Yes, journal presentations. Summative assessment, written examination, which you don't have in the second year. Practical examination, that is bedside. Oral examinations, 5 hours. Research projects, final clinical assessment. That comes in the final year. Quizzes. So here, conduct regular short quizzes at the end of each topic or module. Focus on key concepts, definitions and clinical applications. Then provide immediate feedback for the students. Okay? Then immediately can give it. Class discussion and participation. Encourage active participation in class discussion. Evaluate students' ability to engage with the material and their peers. Use participation as a measure of understanding and engagement. The problem here comes in that if I don't like another student, I'll be arguing. Okay? I'll be having all counterpoints. Record opposition. All counterpoints for whatever the point you give, I have a counterpoint. So you have to see that aspect also. Then case study analysis. And then case studies relevant to the correct topics. As a students ability to apply theoretical knowledge to practical presentations of scenarios. Provide feedback on their diagnostic and therapeutic reasoning. Practical skill assessment. Regularly assess students' practical skills in clinical and laboratory settings. Use checklists and direct observations to evaluate the competencies. Then provide constructive feedback to improve skills. Group projects and presentations. Assign group projects on interdisciplinary topics. Evaluate the quality of research, collaboration and presentation skills. As I said that present is checklist. Same you have to have a checklist. And as per that you have to evaluate. Provide feedback on both group and individual performance. Reflective diary or journals. Encourage students to maintain reflective journals. Assess their ability to critically reflect on their learning experiences and clinical practice. And provide feedback to guide their reflective practice. I think no students will write. You want to do it. Okay. Interest will write all nice things. Written examination. Conduct comprehensive written examinations at the end of each term or the academic year. Include mix of multiple choice questions, short answer questions, and essay questions. So, here was how we have to divide. Assess overall understanding and retention of the syllabus content. So, the whole objective is to assess overall understanding and how much the student is able to remember or retain. And practical and bedside examinations. Conduct practical bedside exams to assess the clinical skills. Use objective structured clinical examination and skill stations. Evaluate students' proficiency in performing clinical procedures and examination. Okay. So here we can use the case extensively. Oral examination.
Sir, please kindly elaborate the first case.
I'll come to that. Oral examination. Conduct oral exams to assess Indian knowledge and critical thinking. Include questions from theoretical concepts, case scenarios, and practical skills. Evaluate students' ability to articulate their understanding and reasoning. Okay. So the whole thing is that it's not that I will ask the definition or define knowledge from it. Not that. So we have to ask a little more so that we will understand what the student is thinking or what the concepts are. Research projects and thesis. Okay. Like STSH or doing internship there for submitting my dissertation work or the PGs. Assign individual research projects. Evaluate the quality of the analysis and presentation. Assess the ability to conduct independent research and contribute to the field. So this is the whole objective of this particular exercise. That after coming out, the individual student will be able to contribute to the system. Final clinical assessment. Conduct a comprehensive clinical assessment at the end of the course. That is the final year. Include direct observation of clinical skills, patient interactions, and diagnostic reasoning. Evaluate overall clinical competency and readiness for the professional practice. So, I feel that is right. Blueprint for examinations. So, practical examination. Assessment method, internal assessment, and practical examinations. Two things are there for us. So, internal assessments are conducted through periodical assessment and term-based. With marks from these assessments contributed to the final marks of the final fitness university examination. So, as per to this. Okay. Then, practical examinations include various components such as case taking, examination skills, question answer sessions, and spotters. Each component is assigned specific marks. Specific marks are given. For example, 20 marks for case taking and 10 marks for examination skills. So, Viva. The Viva was component is part of both term-based and practical examination, carrying 50 marks in each term. Okay, at the end of the first term, at the end of the second term, we have another Viva examinations. Breakdown of the practical examinations. So case taking, 20 marks are assigned for detailed history taking and understanding the patient symptoms. Is all there? Examination skills, 10 marks for demonstrating proper clinical examination skills. Bedside question association, 15 marks for demonstrating understanding of the concepts and application of the knowledge. Then spotters, 5 marks for identifying the instruments, interpreting the reports and the diagnostics. Okay. So 20, 30, 45, 50. That is the division. Okay, dimension for assessment and scoring for particular clinical examination. So these are the criteria. How we are going to say that is good, bad, worse. So excellent, good, satisfactory, needs improvement or poor. So this is history taking, this is the history taking, practical examination and communication. Okay, these are the areas how we are going to evaluate and say that is excellent, is good, is satisfactory or we have to improve. Okay, so these are the points that we need to remember. Case taking. So 20 marks how we are dividing it. The skill, elicit comprehensive patient history, including presenting complaints, past medical history, family history, and personal history. Description, the student's ability is what they are evaluating. Student's ability to comprehensively document and understand the patient's history is evaluated. Then assessment criteria, completeness and relevance of the history taken. Okay. Accuracy in documenting the patient's symptoms. Use appropriate medical terminology. So these three things become very essential. Okay, completeness and relevance. So sometimes what happens is that the patient on that particular day morning got up and was taking breakfast, all those things are there. Okay, so that is not necessary. It's what happened, how it happened. What is the progression from then to now? What are the changes that have come up in the presentation? So that becomes important. Examination skills 10 marks. So skill, conduct a thorough physical examination and demonstrate the clinical skill. Description, students are assessed on their ability to properly demonstrate the examination skills. This includes the accurate performance of physical examination techniques. So for example, many times we ask the students in the bedside, okay, auscultate the cardiovascular system. So what the student does, he will put up the stethoscope and he will put the stent directly on the chest. Okay, but what the technique says that you are supposed to identify the ventricles, where it is palpated. Then second thing, you have to identify the second intercostal space based on the jugular angle, or sternal-jugular angle. Okay, now the mandible is done. So there you have to identify the second intercostal space. After that you start the examination, either from the mitral area or from the aortic. Okay, this is the whole process. But if the student doesn't do that, then it is an error. Assessment criteria, proper demonstration of the examination technique, ability to identify clinical signs accurately, and appropriate use of the diagnostic tools. So here for example, if you are asking the student to demonstrate the vibration sense, for example, the patient is in chronic diabetic neuropathy. Examination of the vibration sense, he will take one IQ from his pocket and do. But he is supposed to use 128, not 256 or 505. Okay, first thing. Second thing is that he has to demonstrate to the patient what he or she is supposed to feel. That is, he has to hit and keep it on the sternum of the patient so that he can feel the vibration. Because when you are keeping, you are feeling the touch, you are feeling the pressure, you are feeling the vibration. So it is not the first one, the third one the patient has to feel. The same sensation he should be able to appreciate at the distal end of his extremities. Correct. So this is the thing that they are supposed to do. If they are not doing that way, then it is wrong. Bedside question answer sessions. 15 marks. The C. Analyze the clinical data to make a diagnosis. Description. This assesses the student's understanding of concepts and their ability to apply knowledge to identify and discuss the patient's problem. Assessment criteria. Ability to integrate history and examination findings. Formulate educational diagnosis. Develop a rational management plan. So these are the three things that you need to assess when you are having a bedside question answer session. Then in addition to all this, you have to evaluate the communication skills. Communicate effectively with patients and healthcare team members. Assessment criteria: clarity and empathy in communication with the patient. 1. Professionalism in interactions. 2. Active listening and responsiveness to the patient's concerns. Okay, these are the 3 things. Weightage should be given part of the bedside question answer session and assessed throughout the examination process. Not that there is a specific mark allotted for this particular purpose. So, depending on your subjectivity, you give weightage and skill. Demonstrate ethical decision making and professional behavior. Assessment criteria: adherence to the professional standards, maintenance of patient confidentiality, respect for patients' autonomy and diversity. Okay, this is a very tricky topic. Okay, patients' autonomy and diversity, very tricky and very fragile. Weightage: assess during all interactions and document in clinical case discussions and peer review. Documentation skills: how the written document is presented to you. Record patient history, examination findings and management plans accurately. Means the case sheet should be complete. Whatever the case the student has taken for the presentation should have everything. Assessment criteria: clarity and organization of the documentation. Means the things have to follow a particular format and they should be following that. It is not that the general clinical examination comes after the systematic examination. Not like that. So there is a format for us to evaluate and understand what the student has done. So that format has to be followed. Accuracy and completeness of the recorded information. Proper use of medical documentation formats. Weighted assess through charting exercises and case note writing. Knowledge of evidence-based medicine. The last part of the evaluation. Skill: apply knowledge of current evidence-based guidelines in clinical practice. Means when you are having a bedside backup, you can ask the updates. Assessment criteria: demonstration of knowledge of current treatment guidelines, integration of evidence-based practices into patient management, ability to justify clinical decisions with current evidence. Means he should be able to justify his answers based on homeopathic concepts and the modern knowledge or the updated knowledge. So these things have to be complemented. Weightage: part of clinical listening and management plan formulation. Spotters, 5 marks. This includes identifying instruments and their indications, as well as observing and interpreting the medical reports. So the instrument, we can give the medical reports also as spotters. Students are tested on their ability to recognize and understand the use of various medical instruments and to interpret the diagnostic reports accurately. For practical examination or clinical assessment, the following methods and tools can also be used. First is asking, used to evaluate the clinical competence through a series of stations where students perform specific tasks. And second is simulated patient encounters, used to observe communication skills and professionalism. So here, for example, I will be sitting, the student will be taking my case, and how he communicates with me. Okay, I am the simulated patient. Okay, or anybody can be brought in with a set of symptoms that he will be told. These are the set of symptoms you have to talk about, and student will be talking about, and an observer will be there. He will be evaluating him based on the set observation criteria. Okay, so let us ask. Used to evaluate students' clinical skills, knowledge, and behavior in a standardized way. Okay? Such standards are there, formats are there, they are evaluating everyone in the same. It is designed to reflect real life clinical situations. Okay? It is designed to reflect real life clinical situations, making it a valuable tool in healthcare education. Because it is not that we are going to get so many number of patients every time. No. The structure of an OSCE typically includes 1. Stations. Okay, there are multiple stations are there for different evaluations. The OSCE consists of multiple stations, each designed to assess a specific skill or competency. Stations can vary in number depending on the exam, usually ranging from 10 to 20. Each station focuses on a different clinical task such as history taking, physical examination, communication skill or interpretation of clinical data. Depends. Second, it is time limited. Each station is time limited, typically lasting for 5 to 15 minutes. You give specific time. Everyone will be on the same amount of time. No discrimination. The time at each station is strictly monitored and candidates must move to the next station when the time is up. No extra time is given. Simulated patients or managements. So here stations often involve simulated patients. That is, doctors trained to portray a specific medical condition. Okay? Doctors trained to portray a specific medical condition or managements for specific procedures. These simulations allow students to demonstrate their clinical skills in a controlled environment. Then, assessment criteria. Each station has a checklist or a scoring rubric that outlines specific criteria to be assessed, such as accuracy, communication, professionalism, and clinical reasoning. So, you give a station, you formulate the checklist. What all things a student is expected to do, and as per to that, you give the checklist, and an observer is there to tick it. Yes or no, yes or no. That's all. He is not going to do anything else. Okay, it's totally objective evaluation. No marks. Standardization. All candidates are assessed under the same condition with identical stations, scenarios, and scoring criteria. No discrimination. All same. This standardization helps to ensure fairness and consistency in the evaluation process. So, this is the main objective of OSCE. Then, variety of skills assessed. So, what all we can evaluate? OSCEs cover a wide range of skills, including 1. The clinical skills, that is performing physical examination, taking patient history. 2. Communication skills, explaining diagnosis and treatment options to the patient. 3. Procedural skills, performing suturing or catheterization. 4. Decision making, that is interpreting lab results for imaging studies. 5. Professionalism, showing empathy, maintaining patient confidentiality. This is how good I am in all these areas. So depending on which all things you want to evaluate, you have that many number of stations and give the checklist. Immediate feedback. Some OSCEs provide immediate feedback at each station, allowing candidates to learn from their performance before moving to the next station. Depends how much time you have in the game. In other cases, feedback is given after the completion of the entire examination. This finishes all the 10 or 12 stations, and then you give the result. Scoring and result. Scores from all stations are combined to provide an overall grade, pass or fail. Candidates usually receive detailed feedback on their performance, highlighting the strengths and their areas for improvement. Now, example. Simple example. Station title, respiratory system examination. Task, okay, this will be given to the student. Task, you are required to perform a complete respiratory system examination on a standardized patient. Please ensure you verbalize your actions and findings as you proceed. Okay? The time allotted is 10 minutes. So, what are the observations you are supposed to make? What is doing? So, checklist. The first thing, introduction and consent. So, there is a proper introduction. Means, if I am the student, I am going to introduce myself. Clear explanation of procedure, what I am going to do with you. Okay? Then obtain patient's consent. Okay, obtain patient's consent. Next thing is general inspection. So observes for respiratory distress, cyanosis, use of exercise muscles. Then notes any chest deformities or scars. Okay? When I am doing this, I am supposed to verbalize what I have seen. Okay? Then hands and knees list. The checks for the clubbing, peripheral cyanosis, tremors, and TAR stain, means reporting stain. Face and neck examination looks for the conjunctival pallor, central cyanosis, and 6 for GVP and tracheal position. Okay. Next, chest inspection. Observes chest symmetry, the scars, deformities. Notes respiratory rate and rhythm. Palpation. Assesses the chest expansion, both manual and with the tip everything. Checks for tenderness. Evaluates the tactile local conditions. Percussion. Systematic percussion of the chest, that is above down and bilateral. Notes areas of dullness or hyperresonance. Auscultation. Listens to all lung fields. Identifies normal sound, identifies abnormal sounds, performs vocal resonance. The most important, many of the students, they do only the front. The back, nobody is bothered. Okay? So, posterior chest, palpation, percussion, auscultation of the back. All the three. Checks for the sacral edema. Conclusion, thanks the patient, summarizes the findings effectively. So, these are the checklists. Okay? Yes or no, yes done or no, you have to tick, that's all. Codification of competencies for oral examination. Here the student will be evaluated under the following headings. 1. The depth of knowledge. 2. The decision making. 3. The problem solving. And 4. Defending. Okay. So, the student is allowed to defend, they must be offended. Will be offended. Okay, but it is allowed. They are to defend. With that, we will be able to understand what are the concepts, what are the strengths they have, and what are the weaknesses they have. For that. In addition, the student will be assessed on his alertness, values and honesty, communication skills, and ability to perform under stress. Okay. So these are the areas when you are doing the bedside viva examination or the table viva examinations. Both. We have to evaluate all these areas and topics. So division of marks. So in the viva, knowledge and understanding 15 marks, communication skills 10, critical thinking 10, response to questions 10, oral impression 5. So knowledge and understanding, here we will be evaluating the depth of understanding of the subject matter, clarity in explaining the concepts, ability to apply knowledge to practical situations. Communication skills, clarity of expression is how could I be able to explain when I am sitting in front of the examiner. Ability to articulate ideas coherently. Use appropriate language and terminology. We have experienced all these difficulties when we are conducting examinations. All of us have experienced when sitting for the examination, the student going through all these areas of difficulties. We have seen. Critical thinking. Ability to analyze and evaluate the information. This is what are the question you asked. How is he able to understand that and how to respond. Capacity to think logically and draw conclusions. Originality and creativity in responses. This if a complex presentation is given to him, how is he able to reply? Response to questions. Ability to respond to questions promptly and effectively. Depth of understanding and concepts demonstrated in responses. Then confidence and composure under questioning. Overall impression. Professionalism and preparedness. Engagement and enthusiasm for the subject. Adherence to the examination guidelines and decorum. Okay, the last one, that is overall impression, 5 marks. So, on these basis, you are giving the evaluation. Designing timetable and calendar of events. As I said in the beginning, calculate the optimal teaching time in your institution for your subject within the big picture of institutional timetable. Distribute teacher activities, formal learner activities, and assessment activities as per the timetable. Then prepare the calendar of events at institutional, departmental, and faculty levels. So this is you independently have to do at your institutions. Okay? CBDC curriculum doesn't talk about it. Okay? So that's all. Because we are dealing only the second year this time. It is very short. We are not dealing with the theory questions, theory question paper preparation. Because we have to divide the amount of marks for each system or each chapter. As per to that, if it is a essay question, one is long answer question, short answer